Good afternoon, everyone, and thank you for attending our presentation today. The theme for the Comcare conference in 2018 is Fit for the Future, Collaborate, Innovate and Achieve. And this resonates very significantly with Virgin Australia, as one of our 4 core values is collaboration. As we all know, collaboration means the action of working with someone to achieve a desired outcome. It's a means of harnessing strengths, speeding up solutions and increasing efficiency. For Virgin Australia, collaboration is being inclusive and together, working with or involving people, caring for others, being engaging and open, so that every person we come into contact with, whether that be our guests, our customers, our colleagues and the community, will feel experience and better outcomes based on the interactions that we have with them. With this idea in mind of improving outcomes based on collaborative interactions, can I see a show of hands of people that have experienced where they feel collaboration has led to a better outcome? Thank you. And for those of you who haven't had that same experience, where lack of collaboration has led to a worse outcome. As we can all see, for us, collaboration is something that we can all relate to. And in this room, it's something that we've all had a positive experience of and not a negative one. It's great pleasure that Sophie and I share with you today our experience of radical collaboration in building a successful claims management partnership under the Comcare scheme. In accordance with our values, Virgin believes that organisations need to challenge the paradigm of working with third-party claims administrators in order to deliver authentic, person-centred claims management and holistic support for injured workers. This involves departing from the cookie-cutter and tick-the-box approaches of many claims management arrangements and investing in building strong collaborative relationships that are underpinned by shared interests and mutual gain. There are therefore no surprises that we believe self-insurance requires 2 key elements: strong relationships and partnerships built through collaboration and an investment in people strategy. Collaborative relationships are not born, but built and flourished over a period of time. As such, we'll discuss our claims management partnership over 4 key stages: connecting, developing, partnering and innovating. But first, a little bit about Virgin. Virgin Blue entered the market on the 31st of August 2000 with 2 aircraft, 1 route and only 200 team members. The newly branded Virgin Australia was launched in May 2011 and we are now a full-service airline offering 141 operating aircraft, 487 destinations in our virtual global network, more than 9,800 team members, more than 8 million Velocity members, and in 2017, we carried more than 24.2 million passengers. In 2017, we were also awarded Best Airline and Airline Staff in the Australia Pacific region at the World Airline Awards, Best Business Class at the Airline Ratings Airline of the Year Awards, and Best Domestic Airline at the National Travel Industry Awards. 5 entities form the Virgin Australia Group. Virgin Australia Regional Airlines, which has 7,800 team members. Virgin Australia Regional Airlines, which operates primarily in regional Western Australia. Virgin Tech, our engineering arm. Velocity Frequent Flyer, our award-winning rewards program, and Tiger Air, following a 2015 acquisition. Virgin Australia Airlines, or VAA as we know it, is the only part of the group covered under the Comcare scheme. Virgin Australia Regional Airlines, Virgin Tech, Velocity, Tiger and VAA claims lodged prior to licence commencement continue to be managed under the state and territory schemes. Virgin commenced an 8-year self-insurance licence under Comcare from the 30th of September 2016. Drivers for self-insurance included substantial annual premiums, averaging at more than $10 million a year in mainline ports, a high volume of claims, with an average of 384 claims per year in the 5 years prior to self-insurance, considerable variation in incurred claims costs, which was influenced by a large number of claims and the number of large claims. Advantages of self-insurance were twofold. Of course, there were financial benefits, with an estimated 20% reduction in claims costs. However, more importantly, were the people-oriented advantages, including national consistency, where two cabin crew team members in different ports but with the same injury would now receive the same treatment and benefits. A single workers' compensation regulation, making it easier for leaders to provide tailored support and understand the scheme. More proactive risk and claims management through engagement in collaborative partnerships with third-party claims administrators. And reinvestment in people's strategy through the reinstatement of cost savings into prevention, training and rehabilitation activities, which, as I've mentioned, Virgin believe is a requirement for self-insurance. The first part of our partnership was the connecting stage. Virgin first connected with EML in April of 2017. We lodged an application with the Safety, Rehabilitation and Compensation Commission to vary our licence conditions and transition to EML as our third-party claims administrator on the 12th of May. The SRCC approved Virgin's request on the 14th of June with a go-live date of the 1st of September last year, meaning our period from application to go live was only 3 months and 19 days. Needless to say, there was a lot to do in a short period of time. I will now hand over to Sophie to talk through our developing, partnering and innovating stages.
Hi everyone. I'll just firstly talk a little bit about who EML is. So for more than 100 years, EML has been providing specialist personal injury claims management since 1910. We're 100% Australian owned, managed and operated. And we are Australia's only mutual workers' compensation insurer, and we take pride in returning a considerable portion of our profits to fund programs that benefit our members. We've invested more than $40 million in just 5 years, and we're a proud member of the Comcare-led collaborative partnership. Keeps flicking. As personal injury specialists, this is our singular focus, from our board right through to our case managers. We remain undistracted by shareholder expectation on the demands of other insurance lines, and instead we focus our business on the development of our people, systems and processes to support best practice claims management. Currently, our team of over 1,600 people, all personal injury specialists, manage almost 50,000 personal injury claims across multiple jurisdictions. Let's see if it just doesn't like that slide. So this slide shows where EML operates across, and as you can see, it's across multiple schemes in both government-managed insurance schemes, but also as trusted partners of self-insurers like Virgin. We also manage specialised licence, life insurance and accident and health partners nationally. And through our member benefits funding, we're strategic partners to research institutions that specialise in personal injury and mental health. So I'm going to go through how EML and Virgin went through the developing stage of our relationship. So aligned in our values, Virgin and EML really recognise the value in developing relationships to achieve a true partnership approach. And that concept sounds simple, but from our experience, when it's done well, that's when you get the best outcomes. And unfortunately, it's often not done well. So we spent a significant amount of time in the lead up to our contract, starting and developing our relationship. And how we did that, we had a dedicated team in transition of 4 EML personnel and 3 Virgin personnel to support the transition. We made sure that we had strong collaboration and communication across all Virgin workers' compensation, payroll and IT teams, and across EML at multiple levels. EML made sure that we had strong and responsive interactions with Illumina, which is Virgin's claims management system. The commitment had to be demonstrated at all levels, And again, we think that's a real differentiator of our partnership. So right through from executive through to case managers. We had CEO visibility. EML committed that we would only fly Virgin for all of our business travel, and we've enjoyed that experience. We also recruited our case managers early because we realised that we wanted them to be involved in the transition. We made sure that we committed to genuine, authentic conversations. We were prepared to have the hard conversations early, and we didn't just say that to each other, we made sure that happened in action. So to ensure a collaborative transition plan was implemented, we made sure we had strong governance and a commitment to minimising the impact on key stakeholders. So we had executive oversight to make sure that happened. We communicated clear and consistent messages to our stakeholders. We conducted ourselves always in an open and transparent manner. And we ensured we had appropriate governance to manage risks. So Comcare complemented us on implementing a best practice transition. And the reasons for this was that we were at all levels and all parties committed and involved. We focused on the key issues before that they could come up in service delivery. We prioritised communication and contact with injured workers, and our detailed transition plan was very clear about roles and responsibilities. So understanding each other's organisations was really a key step in the development of our relationship, and we conducted a large range of initiatives to make sure that this happened. We did system training of all the different systems that we worked in the contract. EML ran in-house SRC Act training modules for both the EML team and for Virgin. We attended available Comcare training together. And we did site visits across our businesses. And you can see this lovely photo of us on the Melbourne tarmac last winter with the cold wind in our hair. We ran incapacity workshops, really recognising the complexity of that in the licensee environment. And we developed jointly claims management artefacts. So, 1st of September 2017 came around very quickly, and then it was go live. The partnership officially began. But by then, we'd spent so much time developing the relationship that it was really about a whole focus on service delivery. Both of our teams are co-located in Brisbane, so Virgin head office and EML's case management team with support nationally. We recognise the importance of doing a post-transition review of the portfolio immediately after transition. And as as transition experts, EML recognised the value of putting on additional resources in that first 6 months to really make sure we understood the portfolio. So we did some specific initiatives in those early stages to make sure that we understood the portfolio and were working together. So we set up a schedule of review points, which involved the executive right through to the case managers. We hold quarterly performance reviews where our executive attend. We also hold fortnightly post-transition pulse checks to make sure we were doing what we committed to do through transition. We established weekly reporting, working parties for key focus areas to make sure that we actually did remediation. Case conferencing, of course. We had a lot of informal meetings, and we were able to do that because of the relationship development that we'd done. And of course, provider meetings to make sure we were all on the same page. So 6 months into our partnership, we could move into the innovating stage. This really allowed us to step back and have a more strategic view of the portfolio. So to support this, we've introduced quarterly Zoom out sessions, quarterly strategic claims reviews where we can look at the claim portfolio from a strategic perspective, a data analytics program that supports that, and really continuing to align our culture and commitment to customer service. We've developed a joint program of work to make sure that we always have continuous improvement, and that includes innovation and a continuous improvement register. It's also allowed us to start to introduce Virgin to EML's innovation programs. So with the portfolio stable 6 months in, we were able to further align the model through the introduction of an EML strategic case manager. Virgin introduced an entitlements and performance specialist, also an additional Virgin claims liaison officer and injury management specialist, and co-location in the Virgin network. So this means that our case managers spend time in the Virgin offices alongside the injury management specialists. We're very proud of our outcomes to date. I'm going to bombard you with statistics. So on transition, we had 161 claims, and by June 2018 of the next year, we were at 144 open claims. So what does that mean? From October to June, 172 claims were closed and 156 claims were opened. Now that's a closure rate of about 112%. As you know, in a long tail scheme, being able to close more claims than those received is a real achievement. So we now have a stable portfolio of 140 claims. Now, of course, it's early days on an appeal rate, but we're very proud of how it's going. So in the life of the Virgin licence, they've had 25 considerations, which were initiated by the claimant, of which only 5 have then been appealed. So that's an appeal rate about 5% for the Virgin portfolio. Since we began our partnership, there's been 16 reconsiderations initiated by the claimant, of which only 1 has been appealed, a 6% appeal rate. Now, we recognise that it's early, but just to give you some comparison, the combined appeal rate for all Comcare licensees is 41.5%. Those licensees in the room will know very well LKPIs. So 9 months into the partnership, all joint licensee KPIs are on target. So median incapacity is running better than target for year to date at 4.5 weeks against a target of 5.5. New claims monthly results have been better than target. The target's 85%. On average, we've been achieving 90%. And the requests for reconsideration, we're achieving an average of 85.9% against a target of 85. Now I'll hand over to Nat to go through our audit results.
Thank you, Sophie. Audit results also had a positive outcome, with us receiving a 90% conformance against the Comcare Claims Management System audit tool in our March 2018 audit by Comcare. This is an outstanding result for a licensee only halfway through their second year of licence. A non-conformance is related to incapacity payments, which is not uncommon due to the complex employment arrangements of Virgin in a traditionally corporate compensation scheme. Our collaborative partnership contributed to a positive result through a united approach in preparing audit documentation, completion of audit in the presence of both parties, development and utilisation of joint procedures and systems, joint monitoring and closure of corrective actions, Virgin's understanding of the EML claims management model and vice versa, EML's understanding of our business, and finally, maintenance of our strong working relationship. Financial results to 30 June also speak a positive story. Our experience is considerably better than expected at the previous half-year review, which was undertaken in December 2017, with our for both our number of claims reported, which is down 45%, and claim payments, which is down 28%. Our outstanding claims liability is also 14% lower than projected pre-licence, which we believe is due to lower than expected claims numbers, with an average of 200 a year versus 384 pre-licence. But most importantly, the outcomes for our injured workers are best practice. Meet Mrs A. Mrs A is a cabin crew trainer who was ex-cabin crew and had 3 previous claims under the State and Territory scheme. Mrs A also had a previous claim under the Comcare scheme, a bilateral knee injury following a fall at work in November of 2016. Unfortunately, Mrs A sustained a new injury to her left knee while demonstrating arming and disarming of doors in October last year. The complexities of the case was that Mrs A disagreed with her specialist diagnosis of her injury and was fearful of the workers' comp process due to a poor experience under the traditional scheme, and this being her second injury at work. Our claims strategy for Mrs A included teleconference at claim lodgement to discuss our approach, supporting treatment and rehabilitation under her previous Comcare claim during claim determination, which offered a holistic person view, case conferencing to gain agreement on next steps, liaison with our on-site physio for education regarding pre-injury duties and injury prevention, which was supported by EML's understanding of our early intervention initiatives, no delays in processing payments, both for incapacity payments and medical expenses, regular, purposeful and meaningful contact from EML and Virgin, where we both preach the same message. And finally, EML working remotely in the Virgin network allowed interaction with Mrs A and her leader in her work environment. These initiatives led to Mrs A being cleared to return to her full pre-injury roles in February of this year with no further treatment required, which is on track with recovery timeframes. As mentioned at the start of our presentation, Virgin believe that self-insurance requires 2 key things: strong relationships and partnerships built through collaboration and investment in people's strategy. Through the success of Virgin's collaborative relationships, especially our claims management partnership and our overall self-insurance program, we have been able to reinvest in our people. Since licence commencement, we have already seen launch of a health and wellbeing program called Better Me, which is one mobile platform that reaches 9,800 employees. A winter wellness campaign offering flu vaccinations, expansion of our on-site physiotherapy service to New Zealand and Brisbane hangar, a group-wide mental health education program called Healthy Minds, an introduction of Tiger Care, which sees our 24/7 injury illness reporting service now available group-wide. In this financial year, we will also see constant advancements to Better Me, implementation of non-work-related injury illness support initiatives, trial of an on-site psych service out of Melbourne, integration of rostering and payroll systems with our Illumina system to facilitate the automatic calculation of incapacity payments, and much more. We celebrated our first year anniversary in formal partnership on the 1st of September of this year. As demonstrated through the 4 steps of connecting, developing, partnering and innovating, a testament of our partnership is a dedicated team on both sides, emphasis on relationships and collaboration, strong executive commitment and an alignment of values. It has been through radically collaborative partnerships, such as that with EML, that Virgin have been able to reinvest in our people's strategy, experience success in our self-insurance licence, ensured the best possible recovery and return to work outcomes for our injured team members, and will be able to continue to do so into the future. Thank you.